Hello and welcome to Integrated Clinical Vignettes with Dr. Carlo Raj. Number 1. A 21-year-old female dies in the ambulance en route to the emergency room from a party in Hollywood. Her accompanying friend narrates that she was extremely intoxicated and was vomiting profusely, when all of a sudden she collapsed onto the bathroom floor. Her friends did not really think anything of it at first, since this was a weekly occurrence and she always seemed to bounce back. She continues to narrate that the deceased female was an aspiring model who had issues with her weight and seemed to always disappear into the bathroom after going out for dinner. What is the most likely cause of the patient's death? A. Adenocarcinoma of the esophagus. With this particular condition, the patient would be complaining of what's known as progressive dysphagia. What's meant by progressive dysphagia? It's the fact that you know that this is a tumor that is slow growing within the esophagus. Usually, adenocarcinoma would be an issue in which you would find with Barrett's esophagus. If you take a look at answer choice C, Barrett's esophagus, that would be a type of metaplasia that would be taking place perhaps secondary to GERD. All of that increased reflux would then cause a metaplasia, in which the normal squamous cells, stratified non-keratinized squamous cells of the esophagus, would then undergo metaplastic change into stomach-like columnar cells. This is the definition of Barrett's esophagus. If the condition is not properly addressed, or the patient is non-compliant, continues to have metaplastic change, then this physiologic adaptation then goes on to become a permanent, irreversible, pathologic cancer, and this would be adenocarcinoma of the esophagus. This is a condition which also would occur more commonly in the distal part of the esophagus. The two cancers that you need to make sure that you know thoroughly include number 1, your adenocarcinoma, secondary to Barrett's esophagus. Another type of adenocarcinoma may arise from obesity. Another type of pattern of esophageal cancer would in fact be squamous. Worldwide, squamous cancer of the esophagus is the most common. Alcohol, all by itself, would result in squamous cancer of the esophagus. If it's associated with GERD, then your differential, or more likely, diagnosis would be adenocarcinoma. But if it's alcohol by itself, it would be squamous. If it's diverticula that you find in the esophagus, known specifically as Zenker's diverticulum, this would also be a type of squamous cancer of the esophagus. Esophageal webs that one might find with Plummer-Vinson syndrome, in which the constellation of symptoms include iron deficiency, achlorhydria, colonychia, glossitis, and esophageal web may result in squamous cancer of the esophagus. What we're finding in the patient here is the fact that the death occurs rather suddenly. There is a weekly occurrence in which the patient is expressing quite a bit of stress on the posterolateral aspect of the esophagus. With that increased stress, then there might be a tearing. That tearing would be called a laceration, in which there would be bleeding into the lumen of the esophagus. But the fact that it would result in death with what's known as a Mallory-Weiss tear is highly unlikely. At some point when the tear then goes on to become a rupture, due to once again increased stress that's incurred upon the esophagus, then the tear now may become a rupture known as Boerhaave syndrome. Boerhaave syndrome, as the name implies, is boring a hole within the esophagus. Imagine the esophageal contents then entering the thoracic cavity. Extremely dangerous, extremely toxic, and the patient oftentimes has high mortality rate. B would be the answer to this question. Perforation of the gastric peptic ulcer disease. Peptic ulcer disease could be caused by NSAIDs in elderly patient. In the United States, the eradication or the proper and effective management of H. pylori has reduced the cause of peptic ulcer disease as a result of H. pylori. However, a patient taking NSAIDs, non-steroidal anti-inflammatory drug in which the prostaglandin E levels drop over a long period of time, and therefore renders the lining of the stomach susceptible to acid abuse, and therefore may result in peptic ulcer disease, usually found in patients that are older. They might be suffering from osteoarthritis. If there's a complication, it would be bleeding. That bleeding may result chronically into iron deficiency anemia. A complication found in a smaller percentage of individuals, approximately 20% with gastric PUD, is a perforation. Prior to this, the patient might have been experiencing epigastric pain upon consumption of food. Shortly thereafter, gastric PUD. A duodenal PUD is much more common than a gastric PUD. A duodenal PUD is one in which the patient may be complaining of pain, epigastric, hours later, sometimes relieved with food, a duodenal peptic ulcer disease. In both instances, gastric or duodenal peptic ulcer disease, you must be checking for H. pylori. If found, then treat adequately. A complication of perforation with gastric peptic ulcer disease usually would occur in the lesser curvature of the stomach and may affect the left gastric artery. If such a condition would take place with perforation, then air may escape into the peritoneum. Not just air, but then acid, obviously, would also enter the peritoneum and so therefore cause an immediate sympathetic response in which vasoactive peptides are released, and so therefore the patient may be presenting with cold, clammy skin, tachycardia, a state of shock. In addition, as you continue through the perforation, and if the patient has not been initially assessed, the stomach will be extremely rigid, almost board-like. If the condition worsens with perforation because of that loss of fluid, known as third spacing into the peritoneal cavity, then the patient may be suffering from cardiac issues. The answer to this question, based on the symptoms and the circumstances of our patient, with death, with the fact that the patient is consistently retching, vomiting on a weekly basis, incurring stress upon the esophagus, going from laceration and into death, would most likely be the result of Boerhaave syndrome.